So the last speaker of the day is Arjum Khurshid. He's the director of the data integration at the Dell Medical Center for the Department of Population Health. Arjum is a nationally recognized leader in the fields of population health and health information technology. Early in the summer, Arjum worked with the City of Austin and the Austin Blockchain Collective to hold a hackathon to tackle some of the challenges involved in developing a blockchain-based solution to improve the conditions of homeless people in the City of Austin, and today he's here to talk about it. Thank you.
Close to good afternoon, but good morning, everyone. Very pleased to be here. Thank you for arranging this for the Macomb School and Austin Blockchain Collective. Very pleased to be here. So I want to basically talk about application or potential application of blockchain by starting off with describing a problem that we have been trying to solve in the health data, health information world, and then seeing how we have, at least at the medical school, been thinking about understanding how some of the new technologies may help answer some of the questions that we have been talking about. So one of the key things that has happened in the healthcare area in the US is that in 2004, President Bush had announced that we would have the records, medical records of all Americans digitized or in electronic format. And between 2008 and now, the adoption of electronic medical records has been tremendous. Now almost like 99% of hospitals are using electronic medical records. Most private physicians, almost close to 90%, are using electronic medical records. But some of the things that we did not foresee in terms of digitizing or making electronic medical records or paper records into electronic medical records was the fact that a patient actually goes to different organizations, different providers, and the connectivity between those systems was not part of the plan in terms of implementing this policy. So as a result of this, we are now left with some really chronic problems in how medical information is shared and managed in the US. One is that it is very fragmented because the data is collected by organizations and by entities who are providing services, so they don't necessarily follow the individual, so which means that my health information actually resides in many different organizations' databases that don't necessarily talk to each other. So it is fragmented and siloed. Second, that in order to access that data in these different silos, the rules are different. So every organization has their own rules because it is also sensitive and private data. And you don't want that data to be in the hands of people who are not authorized for having access to this. I'll be uncomfortable if my data are available on the internet openly about my medical records, unless I have decided to do that. So organizations cannot decide to do that. The third piece is that even when you do get access to that data and you put that together, you realize that there are a lot of problems that have to be cleaned or have to be addressed in terms of cleaning up the data for any meaningful analysis of that data. So if you're thinking of identifying gaps in care, if you're thinking of identifying trends in healthcare usage, all these things require a lot of effort in terms of cleaning up that data. And the problems of this or these data are translated not only in terms of adverse outcomes, medical errors, but also in terms of increased costs for managing conditions. So this is a study looked at 500,000 patients, classified them in terms of whether their information was in fragmented versus less fragmented systems. So between the yellow and the red circles, you will see between least fragmented to most fragmented, the cost of managing a condition with everything else being kept constant has a big difference, several $1,000s, which can be very, very meaningful for people when a lot of this is coming from out of pocket, or it could be meaningful for employers when you multiply it by the number of employees who have to go through a higher cost because of a fragmentation of system or information. So just to make sure that we understand the gravity of the situation. So a few years ago, I was asked to chair a task force on interoperability, to how systems talk to each other by the federal government. And there are a whole lot of things that have to be addressed in terms of how we manage that data, how we collect that data. It is about the ability to be able to identify patients who are in different systems, because sometimes their names are spelled differently, or some keep full names, some keep shorter names. Ability to locate relevant records, ability to access and interpret the records, because they are also using different terminology in different systems, the governance around it. So there are several issues that are related to how healthcare data is shared with each other in meaningful ways, so that we can improve outcomes and also make the system more efficient. The Dell Medical School, as many of you know, is a new school in the University of Texas at Austin. It has a mission or a vision of a vital inclusive health system, which means not only addressing the inefficiencies in the system and doing innovation in that, but also trying to address some of the disparities in the system, especially as they relate to healthcare and health outcomes. And we do that by revolutionizing or thinking of how we can keep people healthy rather than just treat them for their illnesses. And we have done this work which says that if we are able to share that information seamlessly among different providers, then we can actually think of a much more coordinated system that would be not only efficient from a system perspective, but also will benefit individuals much more effectively. So this is a proposed care coordination network that we have implemented in some communities, where the various silos have been connected with traditional systems of health information technology to make sure that that data flows between different databases effectively. And then comes the blockchain discussion, because as we have been struggling with how we make that data sharing and information sharing seamless, at the same time, how do we provide individuals the ability to be able to see all their data and be able to coordinate all their data, which are still big problems in healthcare. So any one of us, if we want to collect all the medical data for us, it will be fairly costly and tedious. And in fact, most of us will probably not succeed in doing that. So even though this is an area I work in, I have not tried to do that. I basically go for my most recent health records, not my entire health records. And you would think that having access to that information can be a life and death decision sometimes, because if you don't have access to information about previous surgeries or allergies or medications that somebody has been, it can cause a lot of errors in the system. So as we got introduced to this concept of blockchain as a new way of how data are shared, although obviously started off with the financial system, but again we have been very interested in seeing what are its applications in healthcare. Can this technology solve some of the problems that traditional systems have not been able to do? So that was kind of our interest in this. And then as we have looked at what is in the literature, you realize that increasingly there are discussions of how blockchain technology can address some of the problems that we have been trying to address over decades and have spent billions of dollars in trying to develop systems that help us in managing, for instance, counterfeit drugs or pharmaceuticals that are sent globally, and there is the issue of like how do we get these from one place to another in a way that they are that we can verify or validate that they have come from the original source. So there are discussions of how the blockchain technology may help in tracking, from a supply chain perspective, tracking pharmaceuticals as they go from the original production site to eventually to the patient and being able to develop that system. Similarly, there has also been discussion about managing electronic records in the same way. So as you see, these are all peer-reviewed publications in the medical literature that talk about how blockchain technology may help in managing electronic records that can be shared easily. Today, over the last 10 years, the federal government has built in regulations that actually enforce vendors to open them up for sharing data with others. There was data blocking happening for a long time, and Congress had to actually enact something to prevent that in medical records because it was also a business case. And yet, I think there is still an opportunity for thinking of new technologies and how they may address some of the problems that we have not been able to solve with traditional systems. Again, as I think the previous panel was talking about, there are also regulatory and legal issues besides business and cost and technical issues around this. There's the issue of interoperability, so how do different systems talk to each other, and then there are obviously papers that have been discussing this. One of the key things that you will note here is that most of these publications are actually this year. So there isn't a lot of literature on this. I have very few that I found which were also fall 2017, and probably one which was in 2016, but most of this is really new in healthcare, at least the applications in healthcare. So it's definitely an area that we want to do further research and understand where we are going. Similarly for data management, I think there's challenges. So one of the things that we had done then as we started involving in this was to work with our local partners in thinking how do some of these technologies help us or can help us. We also engaged with the Austin Blockchain Collective, which was kind of starting last year when we got engaged with them, because we wanted to tap into the private sector that is thinking about these solutions and seeing how can we think together about this, and saying whatever is being developed on the entrepreneurship side, what are these applications in healthcare, and can we inform the development of those technologies as we go forward, so that we are taking into consideration the culture, the other sensitivities around healthcare data, so that we can have fresh ideas and fresh technologies being adopted to something that we have been trying to work with. As part of that process, we were able to get some funding from Bloomberg Philanthropies and work with the City of Austin's Office of Technology Innovation to think about application of blockchain technology for the homeless population. And you see, a lot of interest was generated even before we had done anything. So it was really the concept of being able to think of new ways of addressing issues. Now, almost every city in the country is suffering from this issue of chronic homelessness, people who are experiencing homelessness. Almost every large city has a homeless management information system. Yet, when you think of homeless in Austin and you talk to any one of them, you will find how fragmented the services are that are being provided to them. How as a society and as a city and as an organization, for a public organization, we have failed a lot of these people in terms of providing them what was needed for them to stand on their feet or come back into whenever they have suffered some events that have led to the homelessness experience. And then it is combined with how it affects the health system as well, because many of these homeless also have mental health conditions that are untreated. They don't have access to care. They don't have records. So whenever they come into an emergency department or a clinical setup, we don't know their history, and therefore they cannot be treated in a systematic fashion for many of their conditions. So it's almost a vicious cycle where, because the system has not intervened at the right time, we have not been able to help a lot of these people get out of the situation they are in. And then it also creates both an economic and other social burdens for others as well, who are not necessarily suffering from this. And as we started talking to understand what are some of the things that can help, so although we started it from the perspective of they are probably high cost, frequent users of emergency department, and their healthcare is very fragmented. But as we started talking to these people, we realized that they have other social services issues as well. And some of the healthcare outcomes are the result of their not having health insurance, they're not having a job, they're not having housing, they're not having transportation, so they can't come to a clinic for regular visits. So all these things, it's a plethora of problems that have to be addressed. And then we realized that some of the EMS paramedics who deal with the homeless on a daily basis, they are picking them up, dropping them in ED. They shared how they help these people get into different government programs, and one of the biggest challenges for them is that either their documents are stolen, they lose their documents, or they are destroyed. So, and in order to get any of these social services, you need to first verify your identity. So you either have to have a driver's license, you have to have a birth certificate, you have to have some previous documentation to show who you are. And that step actually prevented a lot of them to get the services that are meant for them. And usually is a 4 to 6 week process in order to get anyone in identities that they can start even in this process. So where we focused was, how can blockchain help in that identity management? That was kind of the project that we started off. It was a 6-month pilot. Most of it was about really understanding what are the applications, how can we do that? And we started off with the simple thing of saying, okay, a blockchain application that has probably worked for African farmers to ship their coffee, the supply chain applications that we see quite a bit. Can we do that with documents? So if you start with a driver's license and then basically make it available electronically, so wherever a person goes, a person who is experiencing homelessness would be able to show that. But then as we got into the actual implementation of it, we realized there are so many other things that had to be addressed. You had to address how organizations that are providing services, how they would accept that within their systems, because their systems are meant to have a photocopy or a copy of some documentation that they have to keep in order to start services. They had to have like something validated by a government agency before they can do that. They have to have policies about their own organizations to be on a blockchain. Who would allow that to happen? What are the concerns? There were also issues around, where would the data be stored? Who will have access to this? So there were a host of things that we addressed, and part of the hackathon that was done by the city, and the mayor was also present in that, was really trying to understand that first part of it, which is how do you establish digital identity in a living system in a city with multiple providers. So as far as next steps, what we have been now working on, and that what we would like to continue to work on, is how do some of the problems that we are seeing in the system today, how are they addressed by our traditional system, and then how does blockchain promise to do that? So for instance, establishing trust, which has just been discussed. Now in the traditional system, there's usually an entity that helps in sharing this data from different players. There are series of business associate agreements and data use agreements that control who has access to protected health information. It's called PHI. And basically the sharing of the exchange of data is controlled by those things. Now in blockchain, because of the key pieces about the disintermediation and the trust being built by the system itself, there's still a question of, would I want to store any or share any of my sensitive information in a public system? And as an individual, am I the only person who makes that decision? What about sensitive information that I may not even understand is giving sensitive information about me? A test result that I don't know, but if that test result is available on a public system, somebody else can interpret what that means. So there are all these questions that have not been answered right now, that at least we would like to understand more. The cost of the infrastructure, obviously it's very expensive to create these interoperability solutions in the traditional system with different databases, and how do we interact them, connect them. There are companies that have built like billion-dollar businesses around just the connectivity or the integration of different databases. So what we have not understood, in all these literature that I was mentioning, most of these are where people have proposed a solution. They have not necessarily implemented it at scale. So the cost of managing a blockchain system that allows for security, privacy, all the things that we expect in a healthcare information system is not clear. And we are not necessarily thinking of like what would be the other implications of using a public infrastructure for sharing clinical data as well, which is sensitive in nature. Patient matching is a big issue in traditional health systems, because the US does not have a unique ID, so patients have to be matched with other characteristics. It's usually an inaccurate science in terms of doing that. And then if that is done, then what are the privacy concerns, and what amount of information has to be shared in order to match the same person through different systems. There are standards in clinics and clinical data, in terms of how it is stored and how it is managed. Those clinical standards, how do they translate into a blockchain type application is also a question that has not been addressed yet. There's some, again, thinking about this, but we haven't seen it implemented in any large system. And a lot of healthcare, I think, is conservative in terms of adopting new technology, especially when they relate to the lives of human beings. So therefore, there is a tall order in terms of evidence that will be needed to make sure that we are able to demonstrate how these things will be adopted at scale. And similarly, there are issues of governance, there are issues of ownership and control of the data. And as you think of larger aggregated data and access to that data, then what would be the rules that will be governing it? So our experience of implementing something to test how blockchain technology may address a problem with a subpopulation, a really small population. There are 12,000 or so estimated people experiencing homelessness, but a high need population in our city actually led us to understand that there are many issues that have to be addressed still before we can implement the technology in at least healthcare at a large scale. So that was our experience. Any questions? Any ideas? Yes.
Have you looked at implementing this blockchain in a closed provider network, so something like Baylor Scott and White, where their patients or people covered by that insurance operate within a set parameter of providers and you have streamlined services? I feel like this application in that realm might be a start.
Yeah, so I think coming back to another discussion that we were having is that when you start thinking of just a health system implementing it, then obviously the question is, so why then blockchain? Like, aren't we doing that in our systems already that we have implemented and spent millions of dollars? So there's still an argument to be made in terms of what are the additional benefits of setting up a closed network like that and using blockchain technology. Again, it has to have enough of a value add that you would be able to move away from systems that otherwise work in terms of how they are connected to monitors and equipment and how people are used to it and the training that will be required, which are all, when you think of implementation, even changing your existing electronic medical record to a new medical record that does almost the same things but slightly differently is a multi-year implementation for systems like Baylor Scott and White. So therefore, then you think of, yeah, we might do it for testing purposes, for testing and innovation, but if you think of that as a strategy, the cost of it is really high. And therefore, you have to be 100% sure that it will work and provide you the benefits of going through all that trouble. Plus, there are also legal and regulatory consequences of moving from one place to another. I mean, the existing system, we have at least worked out what the safety is, what are the regular policies that we need to have in place that will protect an organization in case of a breach or something else. But in blockchain, how do you get that confirmation is a challenge. It's a very interesting topic, though. Yes, ma'am. Yeah. Okay. Finish in time. Thank you very much. Thank you.